Hello, my name's Dr. Steve Bandula and I'm a consultant clinical radiologist at University College Hospital. I specialise in treating and diagnosing a range of different cancers. One of the big challenges we have currently with deciding how to manage cancer is being able to distinguish those tumours that will respond to treatments such as radiotherapy. One of the factors that influences this is tumour oxygenation, but unfortunately, we currently don't have a good non-invasive method for assessing tumour oxygenation. Karin's now going to tell you about a non-invasive MRI technique that may allow us to measure tumour oxygenation.
My name's Karin Shmueli and I'm a lecturer in magnetic resonance imaging here in the Department of Medical Physics and Biomedical Engineering at UCL. So Steve gave you the clinical context for this project, and we're looking at tumours that have very low oxygen levels, and that's really important because it means that they often don't respond to radiotherapy. The long-term challenge is to determine the oxygenation levels inside tumours non-invasively. MRI susceptibility mapping is an MRI technique that has the potential to do that. How it works is that it uses the phase, which is a different part of the image. The image is a complex image which has a magnitude and a phase. So with the MRI phase and using physics, we can calculate maps of the local tissue magnetic susceptibility. Susceptibility is a really useful property, and the reason it's useful is because the susceptibility of blood is directly related to its oxygenation levels. So MRI susceptibility maps should allow us to calculate maps of oxygenation levels in tumours in vivo, non-invasively. At the moment, we're working to optimise MRI susceptibility mapping techniques for tumours in vivo. And we need a technique to validate these methods and make sure that the values they give us are the true values, but we don't have a non-invasive way of doing that, and that's where the tumoroids come in. So as Umber will explain, these tumoroids are 3D cellular models that mimic realistic tumours and give realistic oxygenation levels just like the ones you would find in vivo in a patient. So what this project will allow us to do is to collect MRI susceptibility maps of tumoroids. From those maps, we'll be able to calculate the oxygenation levels in the tumoroids and compare them with independent measurements of oxygenation levels in the same tumoroids made with the current gold standard methods using oxygen-sensitive optodes. So there are 3 strands to the project. The first strand is to design and construct tumoroids with realistic oxygenation levels just like tumours. The second strand is to optimise high-resolution MRI susceptibility mapping techniques for imaging these tumoroids. And the third strand is to perform optode oxygenation level measurements in the same tumoroids and compare them with the values that we get from our MRI susceptibility mapping measurements. So Umber Chima is going to tell you all about 3D tumoroids, how they're constructed and what they will allow us to do.
My name is Umber Chima. I'm a senior lecturer in tissue engineering, and recently we've been developing 3D in vitro models of cancer, which we term tumoroids. Now, tumoroids, in essence, are biomimetic models of cancer. So we try to represent the real tumour environment. So we have cancer cells, which we put into an artificial cancer mass, and we surround this with a normal tissue equivalent, which we term the stroma. And what we do is we use natural matrix proteins, such as collagen, laminin, and fibronectin. We use patented techniques to increase the density of such matrix components, and we seed cells in this spatial segregated configuration. What we can then do is measure the invasion of those cancer cells into the normal stroma. We can change the formation of hypoxia gradients dependent upon the cell density at which we seed those tumour cells. So the more dense we make the cancer mass, the more hypoxia will form. And what we're then able to do is create these maps and start looking at how the cancer invades and how hypoxia affects that cancer invasion. So currently we measure hypoxia gradient formation in our tumoroids using invasive optical probes. What we hope to do is by using the MRI have a non-invasive method to measure the formation of these hypoxia gradients. And what we'd like to do is be able to link this to what we see in patients.
UCL is a really great place to do this project because Dr. Chima's lab is world-leading in tumoroid design and construction, and I pioneered MRI magnetic susceptibility methods, and I currently lead a group that has expertise in this very rapidly evolving field. This work should help take us one further step along the translational pipeline and eventually into the clinic. It could also help provide really useful models for testing therapies that promise to increase oxygenation levels and improve the effectiveness of radiotherapy.